In the continued efforts to inform ourselves on the many types of autoimmune diseases, today we cover scleroderma. Scleroderma is Greek for hard skin. It is a rare autoimmune disease whereby the body attacks its own connective tissues, leading to manifestations on the skin, under the skin, and sometimes also on the organs. So as a result, we have types of scleroderma. We have localized scleroderma, which commonly affects the skin and underlying tissues and rarely the organs. And then we have systemic scleroderma, which can be divided into limited and diffuse. The limited type will often manifest itself on the skin. The diffuse one goes to up to and including the organs. And today we are going to concentrate on the limited type of scleroderma. As you said, the limited type commonly manifests on the skin. And the major presentations or symptoms that are seen in the limited kind of scleroderma can be broken down into an acronym we call CREST, C-R-E-S-T. So C stands for calcinosis, which is the deposition of calcium under the skin. R stands for Reynolds phenomena, whereby we have limited supply of blood to the ends of extremities, which is often seen on the fingers. So there's a situation where there is a lot of pain, what would say ischemic pain, because there's limited supply of blood to the ends of extremities. The E is esophageal motility. So these patients present with issues with digestion. Commonly they have a lot of regurgitation and issues with swallowing food. S stands for sclerodactyly, which is the most obvious thing that you see. What happens is that the fatty folds on areas where we have joints are lost. As a result, we have stretching of the skin, and the skin normally looks very shiny, and it can get very painful for patients because their range of motion at the joint, like moving your finger at the joint like this, is limited. And lastly, we have T, telangiectasia, which really is the formation of spiderweb-like veins in the mouth and other areas of the body. Being an autoimmune condition, scleroderma does not have a cure per se, but it is managed by a specialist called a rheumatologist, whereby the symptoms can be manageable and the patient is able to have a relatively normal life.